My name is Mohammad Raihan, and I am a PhD researcher in community health sciences at the University of Calgary. The problem I am working in my PhD thesis is one that I hear again and again in immigrant communities in Calgary. So almost every time I sit with any immigrants, I hear a version of the same story, like someone who arrived in Canada as healthy, but then experienced unmet healthcare needs, or they have struggled to get even basic healthcare services. For example, waiting months for appointments, not understanding the healthcare system, or feeling unheard because of their language or culture. So these stories stays with me, and to me, they are not just data points. They are people who deserve opportunities, including equitable healthcare access. So that is what drives my PhD work in the community health sciences. As a community engaged researcher, my idea is developing a community-led bilingual framework using the group concept mapping process that will give immigrants a real voice in defining their healthcare access barriers. That is, instead of the health system identifying what are the problems in immigrants, the community will tell us directly based on their lived and living experiences, which will be in their own words and their own priorities. So we want to transform these lived experiences into a clear visual maps that reveal what are the most important barriers immigrants face and the deepest inequities immigrant experience in their host countries. So my goal is twofold. First one is to return these research findings to the community I'm working with in an accessible and meaningful format. And the second one is to provide primary healthcare teams with culturally informed tools that will strengthen health equity and cultural competence of the healthcare providers. I am applying to the E2I program because I want to move from insight to innovation. There is the insight from gaining from the research to innovation, like creating innovative tools. I want to turn community voices into practical solutions. For example, giving them navigation supports or communication tools, which will improve real-world healthcare access for immigrants. So this program will help me grow as an innovator and equip me to translate community voices into meaningful and sustained change for disadvantaged population like immigrants and racialized communities in Canada. Thank you.